Have you or your loved one ever had paralyzing head pain back of the head or blinding head pain in the back of the head and thought, what's causing it and what can I do? If so, this video is for you. We're going to cover 5 potential causes of head pain in the back of the head. We're going to describe the anatomy of the spine in the back of the head, and we're going to cover the 3 things that you can do to start alleviating that paralyzing head pain in the back of the head. And if there are any amplifying videos, I'm going to include them just up here as an information link on the top right. So watch out for the exclamation mark, and I'll also put them down in the description for you to check out at the end. I'm going to get going right now. Hey guys, so all my videos are translated into 11 different languages, so if you just check out the link there on the right, it's going to describe how you can switch on those subtitles. Hey YouTube family, Dr. Craig Heinsohn, family chiropractor in Ottawa, Ontario, Canada. And on this channel, I give you tips and exercises to reduce neck pain, migraines, and correct upper and lower spine nerve issues. So if this would add value to your life, go down below, boop the like, spank the subscribe, ding the notification bell to all, and then the next week or two when I drop another life-improving video, you're going to have it land straight into your notification box. For context, watch the video all the way through to the end where I have some gifts for you, and when rewatching, use the chapters in the description below to review the info you need. So I'm going to dive straight in with the 5 potential sources of paralyzing pain in the back of head. Number 1, I had a painter friend called Tom. He came to see me in the office. He had paralyzing pain in the back of his head, and he had tingling in his hands and numbness in his arms, and he had migraines at least weekly, which would last an entire day. So his work was obviously being badly affected. It was particularly exacerbated when he was looking up, painting the ceiling, and of course that's something that he was doing regularly. The second example is a lady called Edith. When she attended a few months earlier, she had walked into a kitchen door. Sounds pretty innocent, but she actually concussed herself very seriously. She had migraines and headaches following this and had a lot of pain when looking up. My third example is Haley. She was a 12-year-old who was very active. She'd done a lot of swimming. She found that as puberty kicked in, she noticed herself getting a lot of neck pain and migraines, particularly when putting her head in the extended position, which is something she did regularly when training. Trevor came to us. He was a hockey player who'd been hit in the back of the neck with a hockey stick many years previously. Although he didn't think he had any issues at the time, over the following months and years, he noticed that the mobility in his neck was gradually decreasing, and the pain increased until it actually became unbearable. And the 5th example I'm going to give you are parents Emily and Andrew. They brought us baby Carl, who had a difficult birth with an epidural and induction. The parents noticed the baby had difficulty rotating his head to feed when feeding on one side. He was reluctant to look up when he was on his stomach, and he cried uncontrollably despite being changed and fed. Now all these are potential scenarios leading to paralyzing head pain back of the head. But why? Now there are actually thousands of different stresses which could lead to this type of issue. But in my experience, it all comes down to 3 main stresses: physical, chemical, and emotional. Which when the stress is too big or when there is a weakness in the body, then the nerve system is unable to adapt to the excessive stress. This leads to nerve interference, which leads to muscle imbalance, which in turn leads to structural asymmetry. And when bony structure is asymmetric, it has excess physical stresses, and it starts to change in shape through a process known as Wolff's Law. Wolff's Law is when excess stresses cause the bone to become more dense, or actually cause calcium to be laid down to actually change the shape of the bone. Now let's look at the anatomy of the neck and the back of the head. The neck is the most mobile section of the spine, which also makes it the most prone to instability and imbalance. A typical spinal bone is block-like, and it has an extension at the back called a spinous, which muscles attach to, and when the muscles contract, this moves the section of the spine. But at the top of the spine, underneath the skull, it's a little bit different. The bone at the top is called the occipital bone, and that's shown here on this model. Now the next 2 bones are very atypical. They're not block-like. In fact, the next bone down is called atlas. The occiput slides on atlas backwards and forwards, and the C2 bone, the second segment down, atlas actually rotates on that bone. It's a very specialized bone and it looks like this. Now the occiput itself on the inside is where the brain sits. In this case, the segment of the brain that sits there is the primal brain, and it sits in these curved areas called fossa. So the brain sits there and it extends into the body through the spinal cord. So if you imagine my little finger is the spinal cord, it extends down and at every level comes out at either side and sends signals to every cell, tissue and organ in the body. Now, some chiropractors, because there are hundreds of millions of signals passing into the body every single second through this specialist bone, some chiropractors call this the mouth of God. And when there is an imbalance, there is a school of thought that the spinal cord, which is surrounded by a sheath, and inside the sheath is filled with fluid. The sheath is called the thecal sac, and the fluid is called cerebral spinal fluid. That fluid flows down the spinal column, back up, and around the brain, and it actually brings nutrition to the central nervous system and removes toxins. The thinking is, if the spine is torsioned, this can put pressure on the flow going around the brain, which in turn can lead to toxic buildup, potentially leading to problems such as migraine type symptoms. So now I'm going to discuss 3 things that you can do to start to alleviating that paralyzing head pain in the back of the head, and stay to the end, and I'm going to give you a 4th bonus game changer strategy. So the first strategy is to actually identify this specialist bone in your own body, okay? And it's pretty neat to do, and it's actually a lot of fun, and kids love this, and it's kind of a little bit freaky, all right? So you're going to enjoy this. So what we're going to do, you're going to use your fingers to identify where this C1 bone is. So basically, if we just go behind the ear, you feel a bony area. That is actually the tuberous portion of the back of the occiput. It's this area here. So you're feeling the bony area there, and you're going to slide down just off the skull. You can feel the ridge of the skull as you come off the bony area. Okay, I'm going to turn side on so you can see what I'm pressing. So as we come off the bony area there, you actually hit a muscular ridge where you have 2 or 3 muscles coming together. Now these 2 major bands of muscles come together, and there's actually a crease. And when you slide your finger backwards and forwards horizontally under the skull, you can feel that crease. Now when you're in the crease on both sides, when you've got both fingers in the crease, what you're going to do, you're going to press hard into the crease on one side, and you should feel your other finger move if C1 is mobile enough. It should, in a healthy spine, be mobile enough so that when you press one side, you can feel it move on the other side. Now, that's me doing that there. For me, I'm actually feeling it easily when I'm pressing right to left. Not quite so easy going left to right. So that, to me, tells me I need to be checked by my chiropractor. So for yourself, if you've never been adjusted before, when you're pressing, it may feel like a really uncomfortable tickle. That is a typical sign of spinal imbalance. The other thing to be a little careful of is if you regularly suffer with migraines, when you start pressing in this area, it may actually trigger a migraine. In worse situations, if you're pressing here, it can actually trigger shooting pain into the arms. But that's usually a pretty extreme situation. Now you know where that top bone is. If you're getting a lot of discomfort or you're feeling something just isn't right there, then that's a really good indication that you should get yourself checked out. Okay, the second strategy I'm going to teach you is spinal hygiene exercises. So in my office, once we get people adjusted, once their bodies are moving well, then I give them a program of spinal hygiene exercises. This is a little bit like you've been to the dentist, they've done the repair work, and now they show you how to brush your teeth. So it's not going to make you stronger, it's not going to make your lungs bigger. However, it's going to help your spine last much, much longer. A little bit like brushing your teeth helps your teeth last much longer. And if you just pop up here to the right, I'm going to pop some videos up there and a playlist for spinal hygiene exercises. And obviously just check with your chiropractor before you do them to make sure they're right for you. And then the third strategy is to either reduce the stresses that we talked about, physical, chemical, and emotional, or raise the body's ability to deal with stress. Both will have the same effect of allowing your body to adapt better, and over a period of time that's going to contribute towards reducing the frequency of symptomatology due to imbalance at the top of the spine. So for example, me personally, I love playing rugby. I get a lot out of it. That's not good for my body, but it is good for my soul. However, I've recently made the decision that instead of playing full contact rugby, I'm going to play touch rugby, because I still get a good workout, but it's much less physical stress on my body. So that's one example. You may reduce the amount of chemicals in caffeine or medication, obviously in discussion with your medical doctor, because that's nothing to do with me. And raising the body's ability to deal with stress. In our office, we call it the 4 pillars of health. And it's a little outside the scope of this video, but if you check up top on the right, there's a video link to my website, the Loving Life Pyramid. We have lots of videos there which will help you raise your health in those areas of loving movement, loving food, loving rest, and loving thought. Now, just before we get to the game-changing bonus strategy, I want to take a pause as I have some gifts for you. If you are a comfortable drive from Loving Life Chiropractic at 842 Byron Avenue, Ottawa, Ontario, Canada, K2A0H8, then I would love to invite you to come over for a nice cup of tea, because I'm a Brit and I like tea, and a free 15-minute consultation with me. If you're outside of Ottawa, I have some tips and exercises for you. In both cases, just click on the title of this video at the end to access the description and those gifts. So, the bonus game changer tip, that is this: get adjusted by a chiropractor who has an expertise in detecting imbalance in the upper cervical spine, i.e. the occiput, C1 atlas, and C2 axis. i.e. they are competent to adjust by hand the occiput, atlas, or axis. Not just adults, but also children. Then I'm confident that you'll be in good hands to help you overcome paralyzing head pain back of head. And below here now, there are 2 videos. The one on the left is a playlist about migraines and some of the things you can do to overcome paralyzing pain from the back of the head. And the video here on the right has been specially selected for you. And if you pause now, click the title, check out the gifts I have for you in the description. And I will see you on the next one. Dr. Craig, out.